Hello, future nurses. Let me ask you something. A patient suddenly complains of severe muscle weakness, irregular heartbeat, fatigue. The ECG monitor starts showing abnormal rhythms. What could be the reason? Is it the heart itself? Or is something else controlling the heart? The answer is often potassium. Today we will understand potassium in a deep conceptual way so that when you see a patient, you can actually predict what is happening inside the body. By the end of this lesson, you will understand why potassium is mostly inside the cell, how potassium controls nerve signals, why potassium imbalance affects the heart, hypokalemia and hyperkalemia deeply. Real hospital scenarios nurses see. Let's start from the basic physiology first. Where potassium lives in the body. The first concept every nurse must understand. Potassium is an intracellular electrolyte. This means 98% of potassium is inside cells. Only 2% is in the blood. Why is this important? Because the difference between potassium inside and outside the cell creates electrical energy. This electrical energy is what allows nerves to send signals, muscles to contract, the heart to beat. Without potassium gradients, the body cannot produce electrical impulses. Potassium and the sodium-potassium pump. Inside every cell, there is a mechanism called the sodium-potassium pump. This pump constantly moves potassium into the cell, sodium out of the cell. Why does the body do this? Because this pump maintains the resting membrane potential of cells. Think of it like charging a battery. When the balance changes, the battery discharges, causing a nerve impulse or muscle contraction. This is how the heart contracts rhythmically. Why potassium is critical for the heart. The heart works on electrical signals. Potassium controls the repolarization phase of cardiac cells. Repolarization means the heart muscle resetting itself after every beat. If potassium levels change, electrical signals become unstable. Heart rhythm becomes abnormal. Dangerous arrhythmias can occur. This is why electrolyte monitoring is critical in hospitals. Normal potassium levels. For nurses, remembering lab values is essential. Normal potassium level. 3.5 to 5.0 milliquat EQ. Let's interpret this clinically. Level meaning 3.5 hypokalemia, 3.5 to 5 normal, 5 hyperkalemia. Even small changes outside this range can affect cardiac conduction. Hypokalemia, low potassium. Hypokalemia occurs when potassium falls below 3.5 milliequivalents per liter. Let's understand why this happens. Causes nurses often see. One major cause is diuretics like furosemide. These medications increase urine production. When urine increases, potassium is lost through the kidneys. Other causes include severe vomiting, chronic diarrhea, poor nutrition, excess insulin therapy, symptoms of hypokalemia. When potassium is low, muscles cannot function properly. Patients may experience muscle weakness, leg cramps, fatigue, constipation. Why constipation? Because the intestinal muscles become weak. In severe cases, paralysis can occur. Dangerous cardiac arrhythmias may develop. ECG changes in hypokalemia. On an ECG, nurses may see flattened T waves, appearance of U waves. These changes indicate that cardiac repolarization is delayed. This is why ECG monitoring is important. Part 6. Hyperkalemia, high potassium. Now let's discuss the opposite problem. Hyperkalemia occurs when potassium rises above 5 milliequivalents per liter. This condition is extremely dangerous. Why? Because excess potassium disrupts the electrical stability of the heart. Causes of hyperkalemia. The most common cause is kidney failure. In patients with chronic kidney disease, the kidneys cannot remove potassium effectively. Other causes include severe burns, tissue destruction, certain medications like spironolactone, symptoms of hyperkalemia. Patients may experience muscle weakness, numbness, palpitations. However, sometimes patients show no symptoms until cardiac arrest occurs. This is why lab monitoring is critical. ECG changes in hyperkalemia. The classic ECG finding is peaked T waves. As potassium rises further, QRS complex widens. Ventricular arrhythmias may occur. This becomes a medical emergency. Emergency treatment. Doctors may administer medications such as calcium gluconate to protect the heart, insulin to shift potassium into cells, sodium polystyrene sulfonate to remove potassium from the body. In severe cases, dialysis may be required. Potassium-rich foods. Foods that increase potassium include bananas, avocados, potatoes, spinach. However, patients with kidney disease must limit potassium intake. Clinical thinking for nurses. Whenever you see a patient with muscle